press did its own count and found more than 4,500 recovering COVID patients from hospitals were released into nursing homes under the state directive that was in effect for nearly two months. What did your state survey numbers show on this, and why 2 weeks after the survey are you not releasing the results of the survey?
We had 68,000 hospitalizations. So the 4,000 number would be a subset of that. And I don't know what information we have that we haven't released at this point. Do you know?
No, I don't think there's any information that we haven't released at this point, but I just want to reiterate once again that the policy that the Department of Health put out was in line directly with the March 13th directive put out by CDC and CMS that read, and I quote, "Nursing homes should admit any individuals from hospitals where COVID is present." Not could, should. That is President Trump's, CMS, and CDC. So I know that there's been a lot of discussion on this topic. There are over a dozen states that did the exact same thing, many of whom were concerned about hospital capacity. At the time, everybody remembers the projections were well into the 140,000 hospital bed range, whereas we started out with, I think it was about 50,000. And so obviously any death is an unfortunate death, and even when you look at in comparison to other states, New Jersey has 5,522 confirmed nursing home deaths, whereas New York is 3,094. Massachusetts, 3,755. Connecticut, 1,487. It's been a national and international tragedy that everybody has had to grapple with, and it is something that we're trying to learn from every day and move forward.
Yeah, actually, let me just comment on that. Look, we're in a political environment here. I get it. I understand it. I'm a big boy. I can say all day long, I refuse to politicize this discussion. And I have not, and I will not, because I represent Democrats and Republicans, and independents, and atheists, and short people, and tall people. And the politics makes no difference to me. I have no political agenda. I have no political aspirations. There's no politics here. I can say that, but we're still in an election year, and people are still playing politics, and this is a hyper-partisan environment. To the extent people want to politicize this issue, and Republicans are saying, well, New York did this. New York followed the president's agency's guidance. So that depoliticizes it. What New York did was follow what the Republican administration said to do. That's not my attempt to politicize it. It's my attempt to depoliticize it. So don't criticize the state for following the president's policy.
Do you believe that having thousands of those patients coming into nursing homes had absolutely nothing to do with the high number of infections and deaths that we've seen in New York?
Yeah, we've gone through the infection rate many times, and there's nothing has changed.
Is there anything in the toolbox? Is there any, I don't know, cutting down on flights from places like that to kind of prevent, or what sort of thinking are you going through in order to prevent a second wave?
Well, look, the second wave, you can have people who come from outside and infect your population, right? That's how we got here in the first place. Where I'm really outraged is how we got infected from Europe when nobody told us. It was all about China, and we're all looking to the West on people coming from China, China travel ban. Meanwhile, it came from the East, and it came from Europe. And nobody ever said, watch out for those European travelers. They could be bringing the coronavirus, because by the time we closed down China, the virus had already left China and was in Europe, and then we have 3 million Europeans come. That's how this happened, which is still mind-boggling to me, that with all these global health organizations, with all these global health experts, public health experts, federal agencies, whole alphabet soup. Nobody realized that the virus had left China and gone to Europe, and nobody realized that people from Europe were then traveling all over the world and bringing the virus. And nobody realized that planes from Europe land at JFK in Newark Airport. I mean, that is still, to me, mind-boggling. But that's how it came here in the first place. New York, a state government does not have the capacity. Look, I couldn't have done anything about it anyway, except yell, right? Legally, the state can't close its borders to European visitors. That's a federal action. I don't believe a state can close its borders to other states. I believe legally that would be challenged, and I'm not even sure the federal government could do that. So I don't believe there's a state role in setting borders. But even if we do get infected by someone, the question really then turns to controlling that infection, and that's testing, tracing, et cetera.